Hello. We're here again with Jen, who has long-suffering and kind as she has agreed to be our examinee for the cardiac system. Jen, do I have your permission to examine you?
Yes.
Thank you very much. At this point, I'd wash my hands. The first thing we're going to do is inspect our patient. Jen, just keep your head in a neutral position and relax. Okay, looking at the chest, I don't see any thrills or heaves on the wall of the chest. We're going to have a look at the jugular and carotid bodies of the neck. We're going to use tangential light. And we are looking for a carotid waveform or a jugular venous pressure waveform, if it exists. Now, Jen's chair is adjusted to 30 degrees. And because one has a history of being a carpenter, we could measure at 90 degrees. Now, in this case, your JVP is not really appreciable, but that's how we would do that from the angle of Louis. Just noting the carotid arteries as well, and I don't see any carotid arterial movement. The next step that we're going to do is palpate. So Jen, I have permission to touch your chest?
Mm-hmm.
Okay. Just going to touch in the top right inner space. No aortic heaves. No appreciable pulmonic or tricuspid heaves. Jen, would you lift your left breast for me with your left hand? Thank you. The fifth inner space now. There's no mitral heaves. And the PMI has been found, and we're about in the fifth, a little higher than you can see, in the left midclavicular line. It's about the size of a penny it feels under the fingertip. You could measure it as well. Thank you very much, Jen. Now, as we're continuing our examination, I'm just going to feel Jen's neck. Only one carotid artery at a time for heaves or thrills or they're not present. Okay. Having palpated the carotid arteries, we don't notice anything abnormal. The next thing we'll do, we could percuss if we could not find the point of maximum impulse by using our percussing technique down from the inner space closest to the ribs on the left sternal edge laterally to the midclavicular line. And we could percuss dullness that way. I'm going to auscultate now. Since she's at 30 degrees neutral, I'm just going to start with my diaphragm. Just breathe normally. Pulmonic. S1 and S2 are appreciable. There's no murmurs in any of these fields. Okay, I'm just going to listen on the side then. Just excuse me. Thank you. Can you do me a favor? Could you sit upright for me, please? Mm-hmm. And then just lean forward ever so slightly. You're doing perfect as you are. Now I'm just going to listen with my stethoscope. The bell and the diaphragm. Just breathe normally. Okay, there's no splitting of the S1 or S2, and I'm just going to go lateral for the mitral. Thank you very much, Jen. What we're also going to do, just to wrap up to make sure there's no mitral stenosis, is Jen, if you could lay your chair quite flat, and I'll have you turn towards your left side, about halfway, and I'm going to place this just to the left of your breast. Is that all right?
Yep.
Thank you. Excuse me. Okay, now with the bell. Thank you very much, Jen. You can sit it back to your normal position. So there's no added sounds. There's no S3 or 4. There's no clicks or splits. And Jen's cardiovascular exam is Done indeed. Thank you very much, Jen.